Okay, well, my computer and phone both say 2 o'clock Eastern, so we'll get started. Thanks everyone for joining us today. My name is Liz Taylor. I'm the Assistant Director at National RTAP, and we're excited to have this session with Ken Hosen, who I'll introduce in a moment. First, we'll go through a few housekeeping slides. I'm sure everyone is pretty familiar with Zoom at this point. But if you need the webinar ID or need to listen in by phone or have trouble with your audio, here's some info, or please send me a chat and I will do my best to help you. So it's best if you use the chat just for getting help with Zoom or sharing comments. Use the Q&A if you have a question and we'll answer them at the end of the webinar. If you want to ask a question verbally or share verbally, raise your hand and we'll call on you at the end. And this will be recorded and the slides and recording will be posted on our website within 1 week. If you're not familiar with us, the National Rural Transit Assistance Program, or National RTAP, is a technical assistance center funded through the 5311 program by FTA. And we provide free training materials and technical assistance to rural and tribal transit providers and state RTAP programs through trainings, but also events like this. We have a review board made up of state DOT and rural and tribal transit agency staff that help us know what's going on the ground and make sure that what we're doing and the materials we're providing are as useful and relevant as possible. So visit our website, nationalrtap.org, for more information. We did launch a new website just a few weeks ago, so if you have trouble finding anything or have an issue, please let us know. So I'm excited to introduce Ken Hosen today. Ken did a webinar for us kind of more about COVID and dealing with planning during COVID in January, and we did hear from a lot of those attendees that they wanted more from him and a little bit more detail. And so we are really excited to have this second webinar, and we extended it for an hour and a half. So there's going to be plenty of time for some questions at the end. And Ken brings a wealth of experience in transportation planning, and as you can see, has done all types of work in transit planning, work with actual systems, but also research, and has done a lot of trainings, and he's very entertaining and engaging. So I really look forward to your presentation, Ken. And we are going to do a quick poll just to gauge who is on the call. So I'm going to, or on the webinar, I'm going to launch that right now. So take a minute to let us know what best describes your organization. You can select multiple if you fall into multiple categories. And then I should be able to share the results when that's done. And then we will move on to Ken's presentation. Leave it open for a few more seconds. 73% participated. All right, pretty good. So I'll wrap that up and hopefully you all can see the results. Most, unsurprisingly, are rural transit providers, a few tribal, some small urbans, 25% small urban, 13% state DOTs and planning organizations, and then some consultants and others. So thanks everyone for joining today. Okay, so I'm going to just switch over to Ken's presentation. Just give me 1 second. Oh, it's paused. I'm sorry, 1 second. Ken, you're messing everything up by not. I didn't have these combined. It's totally fine. Actually, you know what I need to do? I'm sorry. I needed to get out of that one. And now I can do this one. Thanks, everybody. And we'll swap the display settings and hopefully you can all see my screen. How do you see it well, Ken? All right, yep. Sounds great. All right, take it away.
Okay. Well, good morning and good afternoon, everybody, and welcome to our little webinar today. the basics of rural transit service design for the 2020s. Okay, we're moving forward now. This class is basically a quick overview of a couple of courses I've done in the past that were a day or a day and a half. And I did a session for National RTAP in 2019, back in the good old days when we could be face to face. And it was a day-long session just on fixed route planning for small urban and rural areas. Unfortunately, we only have an hour today, so I'm just going to give kind of a broad brush overview of some of the latest ideas from the 2020s and how rural transit may fit into these things. Basically, the ground rules are no loafing on the platform. That is a must. We don't allow loafing. This is an actual sign from Pine Bluff, Arkansas, by the way, for anyone from Arkansas that's familiar with it. Next slide, please. And another ground rule is we're making no assumptions today. That's why we have a sign that said road ends in the water, because you never know. As seen in New Mexico. Next slide, please. No assumptions. We're going to get back to that again. Okay. It's not the 1990s anymore. A while back, I was talking to our good friend, Scott Bogren, about actually the previous webinar and the introduction of some new service designs. And he said, it's like we're operating in the 1990s. And I thought to myself, yeah, that's exactly how I feel. I just hadn't articulated it like that before. So that's basically it. It's time to get out of the 1990s. And I think the goal for this session today, and I'm going to stop my video so you don't have to look at me. The goals for this session today is to help you provide more trips for more residents, for more visitors in the most cost-effective manner. And the bottom line, making a difference. Okay, we all want to make a difference here, and for us, it's ridership. So it's time to toss out the 90s and embrace the present time, which is the 2020s. Technology is part of the answer, and it always will be part of the answer, but it isn't the answer. It helps, but the bottom line is you have to have the right service design. You have to have a smart service design. You can't try and do microtransit with all its great technology in certain areas. It just doesn't work. Other places it does work. So technology, yes, is part of the answer, but you have to have the right service design for the need. And then, so what we're going to try and do today with you is to help you gain a greater awareness of productivity, the driver, pardon the pun, of costs and ridership, and then knowing when to apply each service type. Those being probably the major takeaways here today, I hope. Next slide, please. Well, basically our agenda today is fairly simple. We have 1 hour to discuss service design. I want to start by introducing the need to adapt to the changes all around us, and they are many at this point in time. And a year and a half ago, they became even more changes. I want to talk a little bit about cost control and productivity, and anyone who's been in any of my classes knows I always have to bring up productivity and talk about it. Some people say incessantly, but let's not go there. And then applying the right service design for their particular need. Next slide, please. The great philosopher Garth, you remember Garth once said, hit it again, please. Yep. We fear change. Yeah, and we all fear change. You know, when your spouse comes to you and says, there's going to be some big changes around here, or your boss comes to you and says, big changes are coming, you know, you start to think of Garth and we fear change. Next slide. And I think you have to hit it again. Okay, there we go. Yes, fear change, but also embrace it. It's nothing wrong with fearing it a little bit, but you've got to embrace it. Demographics, technology, communication have made our world very different from just 10 years ago. Rural areas have changed, yet transit is still in the 1990s. So basically, you have this transit system in front of you right there. If transit does not adapt and change, then transit runs the risk of becoming, next slide, irrelevant in the community. And that's a bad place to be. Have you ever heard someone say, there's a bus service here? I lived here all my life. I didn't know there was a bus. In a city, a small city I was in doing a transit plan, I was meeting with the state representative, and he didn't know they had a 4-bus fixed route system that went right by his office all day long. We won't get into that. But the other thing that I'm sure many of you here that run transit here, oh, isn't that the bus for the elderly and disabled? I hear that so often. I hate that. So that's becoming irrelevant in your community. So change is going to have to be the future of transit. We haven't even brought up the COVID yet, but the COVID has changed everything. We know that, but it's not just the fear of the virus that's driving things. It's not just that at all, as I said in the previous webinar, but rather it's a reduction in the need to travel as more people go online and probably stay that way. Next slide, please. The new normal, we're still learning, we're still finding things out, but this much we know, some things will change and they will have an impact on rural transit. We all know about telemedicine now. People are starting to use it more frequently for more things, which means less trips to the doctor's office. Telehealth, other kinds of health travel related needs can also be handled, well, now via video, the telephone, but really via video now. So it should be video medicine. And then telemonitoring, which is having your doctor or a nurse actually monitoring your outcomes without you having to come down to the healthcare facility. That's going to be big, and it's getting bigger. Delivery services, we see trucks now all the time going down our streets, where we might see 1 or 2 a week back in the day. Now we see 10 or 12 a day, and that's each time a truck comes down the street, that's one less trip a person is taking. Working from home, we all know about that. So many of us are working from home now. Commuter trips are getting cut way back, and we don't know where it'll end up. Will it be 50% of what it was? Will it be 75? Will it be 95? We don't know, but we know one thing, commuter service is important to transit, a little less so to rural transit than urban, but it's still important. So then on top of all that, we have new modes in a way of change. Microtransit it's not a new mode, but it's adapting new technology to an older mode and making it new. And then of course we have social distancing, which means that many times now, rather than getting a smaller vehicle, you may want to get a larger vehicle. And so even the types of vehicles are going to change. Next slide, please. Okay, now productivity, here we are. Productivity, I told you I was going to talk about it, is more important than ever. Next slide. Let's talk a little bit about this productivity and cost control thing. In reality, the best way to lower costs is through productivity improvements.
Ken, I think we lost your sound. I'm not hearing you. Hey everyone, are other people not hearing Ken, or is it just me? Yeah, Ken, we lost you. All right, hopefully he can jump back on. So someone just asked what microtransit is, and I'd rather Ken describe it. We did have a webinar it was kind of a while ago now, and we do want to have another one. I feel like it's usually involving technology and doing on-demand trips. Sorry. Oh, here we go. He's back.
Okay, I am really sorry. Can you all hear me?
Yes. There's a little echo. There's a little echo in the room you're in now, but I think we can hear you okay.
Okay, that's two computers.
Oh gosh.
Okay, here we are. We're talking about productivity. Measuring productivity as one-way trips per service hour is the way we do it. And let me show you an example here in the shaded area. The first thing is I'm going to say about this is that safety is always the first consideration, and productivity is only as good as you can safely run. So if you find that you're trying to push your productivity and your drivers are driving too fast, customers are complaining, the police are coming to you and saying you're going too fast, then you're trying to push productivity too far. Safety is always the first consideration. Having said that, let's talk about this. A quick example. At a cost, if you're operating a system at $50 an hour, and you do a productivity of 2 trips per hour, well, it costs $25 per trip. If you're doing 10 trips per hour, that's $5 a trip. And if you're managing to get 25 trips per hour, that's $2 per trip. And that brings your costs down really low, and that's always a good thing. Next slide, please. Okay, the philosophy of paratransit, as I call it, the paratransit trap and fixed route. Paratransit productivity is inherently low. It's probably the lowest productivity of any typical type of service design. As a result, the cost per trip is higher than any other mode, typically on the order of $30, $40, $50 per trip. Paratransit is also arguably the hardest thing to do in all of transit. And I've said this in front of managers of some of the biggest systems with rail and all that, and I've never had any pushback on that. It's one of the hardest things to do in all of transit. And at the same time, modes like fixed route are capable of much higher productivity. So in the end, it's a progression. You might start as a paratransit system, but over time, your productivity may not be able to get any higher because paratransit is not very productive. And you may find you're turning away trips, people aren't riding like they used to. So maybe it's time to go to a different type of service, or to even graduate all the way to fixed route. And higher productivity in the end yields more ridership and lower costs. So we're going to explore some of those opportunities next. Next slide. Service design. Step away from the 90s. Okay, you like that? Okay, all right, good. Next slide, please. Introduction to service design, making the right choice, or is it making the right choice? The most appropriate service for the need. There's a number of different service needs, and to kind of summarize them all, I listed here the major ones. You have in-town service, whether that town is 3,000 people, 5,000, 10,000, 15, 20,000 people. It's in-town service, and there's a variety of service designs that can be used for that. You've got county-wide service out in the rural parts of the county. There's service needs, and there's certain service designs that are better at handling that need than others. And paratransit's the worst. Then there's regional routes, which could also include county-wide service. These are typically a fixed route or a flex route.
And then you have remote rural service that's 30, 40, 50 miles or more from other communities, service that's really, really difficult to get and expensive to get to. We have some approaches that we use very successfully to be able to work with some of the real remote areas in a reasonably cost-effective manner. Making the right choice maximizes your ridership and reduces your costs. But if you make the wrong choice, the results will be low ridership, high cost per trip. Your system will be irrelevant, remember that from earlier. And the worst part of all is your dog won't want to walk with you. Or maybe it's your spouse that doesn't want to walk with you. Someone's not going to want to walk with you. But that is a cute dog. Next slide, please, if you like dogs. Okay, the next thing you have to think about as you're planning your service design and your types of service are, what are your transit attributes? What are the attributes in your community that enhance transit? Are you in a college town? Can you provide student transportation like in some states that is done? Excuse me, that is done. Do you have a military or large governmental installation nearby that might help enhance your ridership? Are there human service transportation needs in the area? What about Medicaid? That's becoming more and more difficult for public transit to serve, but Medicaid is still a possibility. Do you have a local town that's a retail draw that brings in people for shopping? Do you have service needs for commuters, large corporations in your service area or just outside your service area? Do you have any proximity to employment centers, larger cities, so you could provide commuter service into those cities or in towards those larger corporations? Do you have special events? Some communities have special events on a regular basis, and they generate a lot of ridership out of that. I know our friends in Park City, Utah, when they have the Sundance Film Festival, their ridership just absolutely goes through the roof, and it makes them look good, and they do a good job of it too. Other tourism, national parks. If you're adjacent to national parks, there should be some opportunities there. We know the national parks pre-COVID have been exploding in usage, and many of them are in desperate straits, and some have embraced public transit, some form or another. Zion National Park has the shuttle, so you can't even drive past the early stages of the park during the season. You have to take the shuttle bus. More shuttle service to these parks, reduce some of the traffic issues. That's something that's worth looking at if you're adjacent to a national park. Shopping in big box stores, always a possibility. Maybe even getting sponsorships. Perhaps you're on an inner city bus route, or you have the potential to provide inner city type of service, or as a solution to a parking problem, as happened in Hanover, New Hampshire, where they wanted to build a 4-story parking garage in the beautiful old historic downtown. And the transit system, working with the local hospital with a lot of parking, said, why don't you park right outside the downtown in this parking lot for free, and we'll provide the shuttle service into downtown. And they bought that, and they didn't build that 4-story facility, or at least they hadn't as of a few years ago. Okay, so these are some of the attributes. You may be able to think of some more, but start to think of what other attributes do we have here in our community that would be a draw for public transit. Start to think about that. Next slide, please. Okay, another aspect of the planning of this is it's not just where, it's also when. And a great example of that is that different riders have different needs. Commuters need to be at work before 8, and they need to leave shortly after 5. Customers going to school, shopping, personal business, they may not want to spend 9 hours or 10 hours in town, maybe a midday service. And I'll give you an example, and this is an actual example. I say the name of the system when it's positive. When it's negative, I like to protect the guilty and not say what their name is, unless they really get me mad, but no one has done that lately. Anyway, I'm kidding. Which routes generate the most ridership? We had this system where there was a 50-mile route from the remote rural areas into the small city, which didn't have a lot, it's not very big, didn't have a lot of wherewithal, but it had some jobs, some healthcare and some shopping. So the bus arrives in the small city at 8 in the morning, starts at 4:30 in the afternoon. And I have to ask you, think about this, who's going to ride that bus? Is it someone going to work? It's going to get them there late and they're going to have to leave early. So that doesn't work out so good. Is it someone that's going, that has a doctor's appointment? Well, now they got to spend all day there, 7.5 or so hours. Are they going shopping? Well, they better do their shopping right before the bus leaves or their ice cream's going to melt. So they have to stay in this little town for 7 hours, 7.5 hours just to go shopping. What about if the bus arrived in the small city at 7:50 a.m. and departed at 5:20? You might be able to pick up some commuters, perhaps people who need a ride to work. But what if there was a midday round trip on top of that? All of a sudden now, people going for shopping, going for healthcare, going for personal business, they now can ride. You're giving them a chance to ride, whereas the other approach didn't give anybody a chance to ride unless they were desperate. And we hate that. Next slide, please. Fading in. Okay, so always remember that it's just as much when as it is where. The next issue we see, and this has been argued on the national stage, coverage versus ridership. Do we want to make sure everybody has a route going near them, all things to all people? Even in areas that might not be able to sustain fixed route, well, it's only fair if we provide everybody with fixed. If we're providing some people with fixed routes, we should provide everybody with fixed routes. So that's the argument. So you end up getting these long loop routes. The routes take too long. The ice cream rule applies, and you have empty buses and bad publicity. But if you're just seeking ridership, on the other hand, then you're neglecting parts of your service area, and people that are paying taxes aren't getting part of the service. And that's politically going to get you ultimately in big trouble. So there is a third alternative now, and there really has been, but that's seeking ridership, but also making sure that all parts of the service area get some service, even if you're sacrificing your numbers a little bit, even if it makes your productivity, overall productivity, look a little lower, that's okay. So we want to provide the right service for the particular need. So perhaps in this seeking ridership and coverage, you have fixed routes going wherever the densities and the destinations dictate, and in areas with lower densities without any major destinations, perhaps some kind of microtransit is put in place that's less expensive, that can still provide the level of service needed. So seeking ridership is very important, and making sure that everybody in the service area gets some level of service and isn't cheated out of their service as they might see it, is also very important as well. So think in terms of providing different solutions for different parts of your service area, which we're going to cover in a few minutes. Okay, next slide. And here we are. Okay, service design. It's all a matter of the right service design, the right service for the particular need. And there's basically three overall types of service that we concentrate on here. One of them is obviously paratransit, and we're all somewhat familiar with that. And that paratransit could be in real time using microtransit these days, or it could be advanced reservation. You call up the day before and we'll have the vehicle come out. And this whole business of the day before is a very 1990s thing, I gotta say. First place, when you're running one or two buses in an area and someone calls and wants a ride, it's not going to take very long to figure out which vehicle is going to do it. It might take 30 seconds, maybe 20 seconds. If you had a computer, it takes less than a second. The point being that why make people call a day in advance when you can just as easily get them if they call the same day. So paratransit can typically yield a productivity of one or less than one, up to about 6 one-way trips per hour if you're not grouping trips. Paratransit works best in small, well-defined service areas. Small, well-defined service areas that might be towns, 5,000, 3,000, 10,000 people. There might be suburban edges of the urban community that you're still in. Those are the kinds of areas where it can work best. The second type of mode that we've been talking about is fixed route, and this is the gold standard around the world, and it typically produces the highest productivity under the right conditions. And in rural areas, it's typically cities of over 20, 25,000, unless the city has a lot of transit attributes. You can go lower than that, but typically cities and long distance rural routes might be fixed route. They might also be a flex route, and we'll be talking about those opportunities as well. But typically it is some type of scheduled route service for the long distances, so the 50, 60, 70 mile remote rural routes. Hybrid services, these services are, well, they're hybrids. They're a cross between fixed route and paratransit. Some of them are scheduled services without a specific route, and others have a route that can vary. It can flex and go somewhere else if it needs to. Some of these hybrid designs, especially we're going to be talking about fixed schedule service, can be relatively productive in remote rural areas. We've had some real success in dealing with some remote areas by providing a scheduled service. Okay, paratransit and its variants, and we're going to talk about microtransit in a moment. 1990s service is the old traditional day in advance, in town or countywide type service. The other types of paratransit include ADA paratransit, which I think we're all familiar with, required to complement fixed routes, whether it's a smaller area, larger community. It's usually, it would be available in wherever there's a fixed route. And then there are some real-time options, which is really the service in the 2020s. Next slide, please. So let's talk a little bit about microtransit, because typically in the studies I do and the work that I do, many of my clients and the dispatchers just really aren't particularly familiar with microtransit. Well, microtransit's a variant of the old dial-a-ride service where you call up and the vehicle comes and gets you. It may group trips, almost like a taxi. It may group some trips together, but it'll do it basically in real time. And that service model dates back to the 1970s. And in the 1980s, technology was deployed I know of Orange County, California, a county of at the time 1.5 million people, and they had about 30 zones, and each zone had 1 to 3 vehicles in it. And you called up and you got an operator who then typed in your address and immediately downloaded a message on an old, huge MDT to the driver, and then the driver knew to pick you up and would get you within an hour. And they ran that service for quite a number of years until ADA came in, and they couldn't run 2 separate paratransit services at that time, so they had to give this up. But it was a dial-a-ride, which is now morphed into microtransit. And microtransit is dial-a-ride, picking people up at their corner, in front of their house. It's dial-a-ride with really, really hot technology that allows someone to access you over their smartphone or on a regular phone and pay for the trip and tell you when the driver will be there. And the message then immediately goes to the driver, and the driver has to follow the order that the computer gives. And they come and they pick you up within 15 minutes to an hour, depending on how much money you're willing to spend for that service. So it's real simple to use. You can also call, but from a transit operator's perspective, I sat with a dispatcher for about 3 hours one time, who was running the Microtransit, and she was doing all kinds of other things, and only on 2 occasions did she actually even have to look at the Microtransit, because it pretty much runs itself once the drivers are used to the way it operates. So typically you see small buses, minivans, or sedans used in Microtransit. It's similar to a transportation networking company like an Uber or Lyft, but it will group trips for you. And it's most appropriate in lower density, small, well-defined service zones of a few square miles. And I'm looking at some of these in suburban Austin, suburban San Antonio. I'm looking at it on a Native American reservation, in a town of 2,000 people, 30 miles from the next town. I think it has some great opportunities in these kinds of communities, as well as in small towns and cities up to about 15, 20,000 people. It's also effective in the evenings and weekends, where you might be operating fixed route during the day. Lubbock used to do this. I don't know if they still do. And at 7 in the evening, they shut down their 20 bus fixed route system and deploy 4 or 5 dial-a-ride buses to pick up all the people that had need for a trip up until about 10:30 at night after the retail all closed. So it's got a lot of opportunity for deployment. It typically requires an app, and that requires money. And keep in mind that with all of the money that's now going to be coming to transit, this might be an opportunity to invest in some of this technology. And my suggestion is, before you do, go someplace fairly similar to yours that has deployed it, and go and see it working in real time, and talk to the drivers, talk to the dispatchers, and hear what they have to say while their boss is not around. And also talk to the boss, and then determine, is this something that you might be able to implement? It's certainly worth a look in certain situations, but I will caution you with one thing here, is that if you're running a fixed route system that's generating more than 6 or 7 one-way trips per hour, you're not going to get better productivity in dial-a-ride. It is not going to, in most situations, get you more than 6 one-way trips per hour, no matter what the claim. And I'll give you this one insight. I won't say where, but an app provider was bragging about how their new service took over from fixed route and is still doing 8 trips an hour. Well, if you've ever been in this business for a while, you know, in a town of 30,000 people, there's no way you're going to be picking up 8 people an hour and dropping off 8 people an hour in a community of that size, unless they're groups. And these people were not. It's just general public. So we know the operator very well, and we went to talk to the operator, and the operator sent us a message back with a photo of the actual numbers. And it was actually at around 3 one-way trips per hour. So they had a fixed route system that was doing 8 trips an hour, and then went to a dial-a-ride, or excuse me, a Microtransit at 3 trips an hour, and they had to more than double their fleet size in order to do that. So be careful what you're doing. If you're getting more than 6, 7 trips an hour on your fixed route, you really may not want to go to a Microtransit. But again, there are many opportunities where it is an excellent approach. Okay, I've said enough of that for now, and we can save more for questions a little bit later. Next slide, please. Okay, we've gone away from the paratransit, from the, it's also called demand response. It's all basically one and the same. And we're moving from that to fixed route and how old school it is. Fixed route can yield the highest productivity and the lowest cost per trip. Consequently, it can transport the most passengers because you can pull up at a stop and get 10, 15, 20 people on board. You're only limited by the size of your vehicle. So fixed routes used throughout the world, literally, and will continue to be until buses can fly or you can beam me up. I prefer the latter to the former, actually. I don't want to fly on a bus. I'd rather be beamed. Okay, enough of that. ADA complimentary paratransit is required of fixed route. But in rural areas, you have to pick your spots. Fixed route isn't appropriate everywhere in rural areas. Certainly on long distance routes, it may be appropriate, that or a flex route, which we will talk about in a minute. You have a long distance route from, when I worked on was from Española, New Mexico to Chama, about 65 miles. Well, the only way you could operate that service is a fixed route with designated stops and times for stops. And then also, if you can, allow for flag stops. Someone in between the stops that is in a safe location can wave down the bus. Except in New Mexico, that's not legal in New Mexico, but most everywhere else you can. So long distance fixed routes are really or flex routes are really the best way to operate that type of service, the long distance service from isolated areas. Small cities, typically starting at around 25,000 population, a little more, a little less, depending on their transit attributes, is real appropriate for fixed route. But fixed route, it's not just any fixed route. Fixed route has to be done right, and I'm going to show on the next slide my favorite, one of my favorite examples of doing it right and doing it wrong. Next slide, please. Okay, this is a service, a transit system called the Going Nowhere Area Transit System, otherwise known as NATS. Okay, actually I made that up. That's not really its name. But it's a real system, and I'm not going to tell you where. The manager said to me, "We put the service out there, but they won't ride." So you know it was a man because of my voice. But so here's this service. It's a 2-bus operation. In a town of 25,000 people with a significant size university of about 16,000 people. So if you want to take this route, you're on the blue route, and you want to go to the Walmart, it might be a 10-minute ride to the Walmart. But to go home, you have to go through the rest of the route, which is another hour and 20 minutes. Each loop is an hour and a half. So it's 10 minutes to the Walmart and an hour and 20 minutes to get back home. Pretty attractive, huh? Now, if you live on the other route, which is a distinct possibility you would, then that route is an hour and a half. And if you want to go to the Walmart, you get on that route for 10 minutes, you transfer, and in 10 minutes you're at the Walmart. When you want to go home, it's an hour and 10 minutes to transfer, and then another hour and 10 minutes to get back to your original destination, original location. So it's a 3-hour round trip to go to the Walmart or to go to work, if you can imagine that. 3-hour round trip in a town of 25,000 people. That's the setup for this one. Okay, next slide, please. So you ask yourself, who would ride this service and why? So for reasons I won't get into right now, I have ridden it a few times. But just to observe, because that's something that I make a point of doing. And I found out who would ride this service and why. It's people without cars, and the reason they rode is because they're desperate. They had no alternative. This service gets almost no ridership. It gets less than 2 one-way trips per vehicle hour. And it's those long one-way loopers that will get you every single time. And if you sit in on my fixed route design class, we get in detail about the loopers, but I'll show you an example of how not to do a looper in a moment. So ask yourself, does this system meet the ice cream rule? 10 minutes to the Walmart, an hour and 20 minutes home. Not unless they have refrigerator units on the buses, which might be a good idea if this is how you insist on operating your service. Okay, let's show the second example. This one is in Paris. There is actually a stop at the Eiffel Tower. This is a real transit system. And this service design is a little different. It's 4 separate routes of 30-minute round trip. It's called an out and back style service design. The routes go out and they come back basically on the same roads. Typically, if there's a stop on one side of the street, there's a stop on the other side of the street, which means if it's 15 minutes to get to the Walmart, it's 15 minutes to get back home. If it's 30 minutes to the Walmart, it's 30 minutes back home. That's how a normal transit system works. And if you look at any urban system that's been around for any length of time at all, this is the type of routes that you see. The routes go out and they come back, and the coverage is more effective than if you use loopers. You got great coverage, but it's in a looper, but it's totally ineffective because nobody can ride for 3 hours or even an hour and a half. So the longest ride on this for just some people would be an hour, hour and a half. And that would be the maximum. Okay, this system is a real system in a town of about 25,000 people, but there's no university, unlike the NATS system. NATS gets 2 one-way trips per hour. This system, with no real attributes other than the Eiffel Tower, this service gets 8 one-way trips per hour because it's designed right. If that other service was designed right, it would be getting 10, 12 one-way trips per hour, and college students would be using it, but it's not. Okay, that is the power of the proper service design for fixed route. It makes all the difference in the world. So sometimes if your fixed route isn't working, maybe you don't need to change the whole service design. Maybe you just need to change the route structure. Maybe you should say, well, rather than try microtransit, let me try and fix the route structure first. So something else to think about. Okay, next slide, please. Then there is a series of what I call hybrid services that they're not fixed route, they're not paratransit, but there's something in between. And typically they are of scheduled design, usually with no specific route, although not always. Sometimes they do have a route. Typically it requires fairly low densities, suburban areas, small towns. And these different designs are most appropriate for, long, low population density routes, isolated rural areas. It can be real effective in some of these isolated rural areas, and also in small towns, hybrid services can work. So let's look at a few of these. Next slide, please. Fixed schedule service is one of my favorites for large, remote, rural areas where there's not enough resources to cover all parts of the service area at all times. These services are very often covered by paratransit, which means, and sometimes countywide, as I call it, helter-skelter paratransit, where the buses are going all over the place, picking one person up, taking them in, down, going back out, picking another person up, taking them in. This is a scheduled service where it'll serve, let's say, the northwest part of the service area, Monday, Wednesday, and Friday at 9 a.m. And then the northeast part of the service area gets Tuesday and Thursday 9 a.m. service. Maybe it comes back and does a second run later in the day. Maybe it serves in the afternoon a different area, let's say. So I'll show you an example of that in a moment. So it serves different areas according to a schedule that's clearly posted and well marketed. Can be 1 or more days per week, and experience indicate that passengers accept this approach, and doctors and hospitals will cooperate when you work with them on deciding what day each town should get service. One example that we had in northern New Mexico, where the town of Tres Piedras, which is about 25 miles from Taos, something like that, and had not been getting any service because it's not near anything. We put in a fixed schedule service for Thursdays where we make a morning run and then make a midday return and then make an afternoon run. So people could be there all day, or they could be there a half a day, and they could connect to the Taos system or even connect to the regional system and go further than that. But it would be on Thursdays. That's when they would schedule their doctor's appointments. That's when they go to the market. That's when they come into town. And all of a sudden, they're getting 8 passengers each time they come into town because they come in once a week. Everybody rides on that day. They're getting 8 trips each time they go. And last I heard, they're thinking about adding another day to that. So that's an example of fixed schedule service. And I'll show you an example on a grander scale. Next slide, please. This is from Carts, based in outside of Austin, Texas, the 9 counties surrounding Austin. And they have a fixed scheduled service in every one of their counties and every one of their towns. And if you look at this is for Caldwell County. And let me give you an example. If you live in Fentress, the second city down, if you look from the left, then you want to go to San Marcos, the bus goes on Thursdays at 9 a.m. and returns at noon, and it costs you $6. If you want to go to Lockhart and get some barbecue, that's on Monday, also at 9 a.m. And if you want to go to Luling, that's on Friday at 9 a.m. So you can go down to to Lockhart. If you want local service, the next one down, it's Monday through Friday throughout the day, 8 to 4:30. If you want to go to Austin, then you go on the interurban coach, and that's Monday, Wednesday, and Friday. To San Marcos, also Monday, Wednesday, and Friday, and 8 o'clock and 2 o'clock departures, and then the return. So this is a fixed schedule service, and every county in the CARP service area has one of these, and every community is listed. So if you live in Stairtown, you know when you can get to Luling, you know when you can get to San Marcos, you schedule appropriately. This will generate greater productivity because everybody in the community is going at one time, as opposed to 10 different times. This is something worth looking at, and I would suggest that you can go to their website. It's ridecarts.com, and you can look at some of their other schedules. We're actually working with them right now to revise schedules as occasionally needs to happen, as things change, communities change, growth occurs, hospitals move, all those sorts of things. So we're working with them now on that. But this is a great example of that. Also, Rutherford, North Carolina does something very similar for its service from the mountains into Charlotte. They have specific days and times when they go, and that's when you go. So that is a fixed schedule service. Next slide, please.
And Ken, just to ask a quick question, that these departures, I mean, are they doing demand response pickups at those times, or is this a central location where the bus leaves?
Yes, the answer is it will pick people up at their door, and typically there'll be a stop in town, so people that are in town can walk to that as well. But yes, it will pick people up at their door, and it will drop them off at their destination or at the bus transfer point.
Okay, thanks.
I hope that answered your question.
Yes, thank you.
Okay. Service routes is another option, and this many systems operated these service routes before the term was coined. Shopper shuttles, you might have heard of. Those are service routes. It's a service oriented to specific clientele, to specific destinations. Excuse me. It's allergy season here in Austin, my apologies. Such as medical or shopping destinations, can be scheduled for specific days and times, serves the group trips. A couple examples, United grocery store chain up in South Plains, Texas, pays Lubbock Transit to operate shopper shuttles from various senior housing, low-income housing to various United grocery stores on different days of the week for different communities. The schedules are all posted, and United grocery stores pays for the service. Walmart runs contracts to run shopper shuttles in various communities, particularly those that ask and convince Walmart to spend some money there. But There's a number of those in Michigan in particular. And then other grocery store chains and other stores have done something similar as well. And it's a great way to get a sponsor and get them to pay for part or all of the service. HEB here in Austin paid for a route to their superstore from a low income and an elderly high rise every Thursday. And they paid that for about 10 years. And then they turned it into a route. So you can get a sponsor, you can do lots of group trips. You could run from senior apartment complexes, low income communities, those sorts of things. You can target medical destinations, shopping destinations. For kids, you could do a Saturday runs to various parks and recreation type facilities. There's all kinds of things you can do with service routes, and they can also be real good for productivity as well. So get yourself a sponsor, get some service routes going. Next slide, please. This is the old route deviation. Those of you that have been in my sessions before know I hate the term route deviation and have been on a crusade somewhat successfully, not that successfully, to get rid of the term route deviation and replace it with something like flex route, okay? So we need to do that. No more deviating. Okay, so flex routes are basically fixed routes that will go off the route to pick people up to a certain distance under certain conditions. It requires fairly low density, suburban or small town, most appropriate for long, low population density routes. And what they try and do is replace ADA paratransit with and fixed route with one vehicle that does both functions. Unfortunately, it typically does both of them less than effectively than it would have if they were separated. To me, when it's used in urban areas, it provides a lower quality of service because you're constantly going off route and having to sit and wait for your timing point to come up. And it's very inconvenient for many people. And my suggestion is that you operate a fixed route and ADA paratransit with one of your existing vehicles if you can. Route deviation, on the other hand, is great for those real long distance routes that are not commuter-based routes, so you're required to provide ADA paratransit, rather than sending an ADA paratransit vehicle somewhere along a 70-mile route. Just have this vehicle deviate up to 3/4 of a mile and to pick up a person with disabilities and then get back on route. That's where flex routes seem to work the best. I would typically avoid them in small cities. That's just me. Okay, next slide. Okay, so to recap a little bit here, I think we're getting near the end. Should be a round of applause for that. Okay, there's a variety of service designs we'll look at. The first one is that countywide paratransit, real low productivity. My advice is to avoid that at all costs. The next one we're looking at here is microtransit, and again, that's small cities, rural towns, suburban areas can get up to 6 trips per hour, and that's really good. Fixed schedule service in counties, especially from remote areas, those sorts of things. Again, vehicle capacity, same thing with service routes and fixed routes. They all have their niches. There is no one of these services that can work in all the rural areas. So start to think what works best in each different area. That's real important, and fit the best service design to the particular need once you've defined those various needs. Next slide, please. About a couple of weeks ago, I was in Nashville doing a review for a service there, and I was sitting behind the dispatcher for a couple of hours watching him work, and when he had a break, I would talk to him. He'd explain to me what he was doing, and the guy had a lot of passion. He was really engaged and very proactive, and he had a sign, he had a plaque on his wall that said, "Leave no rider behind." So I love it. It's great. Leave no rider behind. There should be an appropriate option for all. Remember what I said, fit the service design to the need. On the other hand, don't let the exception drive the rule. I've seen systems that decided they didn't want to do fixed route because 3 or 4 of their riders wouldn't be able to ride it. Well, forget that. Install the fixed route and find another way, another good, appropriate way to provide service for those people that may have special needs or a particular disability that would not allow them to ride on the fixed route. There's microtransit now, there's taxis, there's TNCs, there's volunteers, there's all kinds of ways to provide safe and accessible transportation for everybody. So don't let the 3 or 4 people drive the need. Find another way to provide service for those folks. Next slide, please. Real quick, just wrapping up on some service planning types of things here. When was the last time your services were evaluated and assessed? Do you look at your, do you have ridership numbers that you look at every month? Do you look at your productivity by route? Do you look at your ridership, your miles, your hours? It's a good thing to do, looking at them all the time. And if you're ready, if you feel you're ready to move to the next level, if you're operating paratransit, remember, you've got a wealth of information on the paratransit origins and destinations. You can very often, if you plot them by the hour, you're going to detect some patterns where you might say, if I run a fixed route along this, I can pick up all these people and a lot more. So things to look at. That's the value of paratransit, is all that great data on origins and destinations. Come up with some new needs. If your service area is changing, look at new ways of providing some of those services. Start to think of some of these approaches. And have a methodology in place for ongoing performance evaluation. Just looking at some simple numbers every month, safety numbers, complaint numbers, productivity and ridership numbers. Those are the things you need to be looking at least every month. I would look at them every day, but that's me. Okay, next slide, please. Also understand your service area, and if you could click one more time. We've got one of my favorite pictures there. There we go. Okay. Don't drive like him, by the way. Please. Get out in your community and drive around, not like him. Get very familiar. If you're not totally familiar with your service area, get very familiar with it. Ride with your drivers for a while. Get out once a week. Ride. Pick a day when you know a very vocal rider is going to be on board, so you can get to listen to them on their turf. Very valuable stuff. I've learned a lot. When I ride buses on every project I do that's related to service. And I've got some great stories, which I won't tell today, but it's always fun. And I've learned some critical stuff virtually every time I go out there. And I've settled an argument or two as well. So get familiar with your service area, understand your attributes, look at your population density, and see what the density tells you. Identify your transit-dependent populations, seniors, elderly, low income, those sorts of things. Identify your major destinations, and then figure out what's the most appropriate and productive service design. Next slide. All right, we are just about done. The last thing I'm going to say is the first thing. Transit's front door. First impressions. If the bus stop or pathway is intimidating, unsafe, hidden, unlit, or inaccessible, then how do we expect people to use transit? Every bus rider is a pedestrian. Next slide. And this is a good lesson in what not to do. And this is a very competent system. They just had a little issue with this stop. Ultimately, it flooded, and I had been shaming them so much in a good-natured way that they got rid of the stop. It's no longer there. The other amusing part of this is that whoever placed the stop wasn't told where to put it. and it's on the side of the road where the end of the line is in 2 miles. And the only people that would use that stop are people coming from the other direction and getting off there. Nobody would use that stop to ride. Nobody would wait for a bus at that stop. They would wait across the street. So that was a little bit of irony in there too, that it was, not only is it in a ditch, but it's not where it could be used. Next slide. And I'd like to thank all of you for making it through the hour. And I encourage you to get a hold of me if you like. Give me a call or an email. I'd be happy to chat with you.
Thank you so much, Ken. Congratulations on making it through the end of your presentation. So we did get a couple questions and I will go through those, but feel free to put your questions into the Q&A box. And if you'd rather kind of ask a question, we have, we have 25 minutes for the rest of Ken's time. So use him if you can. Maybe later on, once we get through some of these more general questions, if you have some kind of specific question about your system that you think you could articulate and get some tips on, you can do that too. But we'll go through a couple of these questions first. So the first question was, what is microtransit? And I kind of was trying to answer it while you were offline, and because I didn't have like a one sentence, and I hope that question was answered, Benjamin, but let me know if not. It's, so go ahead and ask that again if you want more clarification. Another question about microtransit. So you mentioned that microtransit may not be appropriate in some areas. That doesn't that hold true when we talk telehealth, et cetera, as we need technology to support these modes as well? I've seen in rural areas that there may be transitions from long distance trips for healthcare needs to potentially trips to a local library or the like, where someone can access telehealth. How is rural transit and of course service planning and route design adjusting to a potential change in paradigm from this perspective?
Well, that's a great point, and we're actually doing something similar for outreach efforts, where we're setting up viewing centers, perhaps at senior centers, local libraries, where groups of people can come in and kind of view the outreach and do the public meeting. And it's the same for telemedicine. Yes, these folks may not have internet capabilities, but we can transport them to the center or the local library where they can access and get the telemedicine that they need. So absolutely, that's going to change things a little bit. Maybe we'll still get some of that service. It's just be easier to provide rather than going into the big town. We can go into the small town that's close by and drop people off at the library. So there's some benefits there as well for less demanding trips. So that's a good point.
Here's another question about microtransit. Does 5311 or 5310 funding cover microtransit fleets?
Cover microtransit what?
Fleets? Vehicles?
Yes, it could. Yes, if that's the service design that you want, 5311 or 5310 could certainly do that. It's your choice whether to go with a fixed route or a microtransit or any other mode. So yes, that could be done. Now, if your state may have restrictions on what types of vehicles to buy, and you may not be able to buy the most appropriate, but that's something you can work with your state on, especially as microtransit is becoming more and more popular, and we're seeing it more and more in rural areas. And I don't have any stock in any of these companies, and I have nothing to do with any of them, by the way. So I just want to let you know that.
Thanks. Okay. I'm sorry. I was going back to something. Okay. Question about the Michigan example, if you would be able to provide the names of those Michigan transit agencies that are using Walmart sponsorships so they could ask them about it. Do you know the names of those agencies offhand, or
Uh,
maybe we can provide them later?
They're provided by different organizations, some private, some public. And the last time I looked, and they've shifted over the years. The last time I looked, they were operating some in I believe in Muskegon and I believe in Kalamazoo, and there might be others as well, but I haven't checked with them lately. But I know that was being done, and I also know that the sponsorships are very similar, like United Grocery Stores up in the South Plains of Texas, and the HEB. Unfortunately, they're both Texas examples, but they're good ones in terms of being sponsors. Also with Walmart, you can go now to the regional. In the past, you had to go to corporate to get any kind of funding from them. But now the regional managers are empowered to be able to, with a certain amount of money, to be able to work with transit systems. And the Walton Family Foundation has got a ton of money available for public transit as well. And those are the places where you want to go, perhaps to to make the argument and get some money.
Okay, great, thanks. Here's a question. To clarify, a deviated or flex fixed route does not require complimentary paratransit? Are there cases when it does?
Not really. If you know, it gets complicated, but if you open flex route to the general public, then everybody plays by the same rules, which means people with disabilities may only be allowed to get a half a mile flex, not the 3/4 mile, and they may be rejected because the bus has already got two people on two flexes on it. To me, that's a way of getting around ADA, and that's not something I would ever recommend. What I would recommend is that you do the flex for people with disabilities. You do it up to 3/4 of a mile, and you do it according to the parameters of ADA. And if you want to open it to other people, that's fine, but you need to give people with disabilities their full access. And the way the rules are written is that there is a huge loophole, and I don't think anyone should be taking advantage of that. That's my editorial comment.
Yep. Thank you, Ken. That's great. Okay, here's another question. How does a fixed route from a senior living apartment to a grocery store, how is it not considered charter service?
Well, if it's open to the public, it's not charter service. And if people pay a fare, it's no one is necessarily paying the fare. There might be a sponsor, but they're sponsoring your system overall. They're not, it's open to the public, so it's not charter service.
Right. Thanks. Okay. I'm going to jump to a couple questions I saw in the chat. What is the major difference between demand response and microtransit?
Demand response we got too many names for the same thing. Demand response and paratransit are basically the same thing. It's a door-to-door, curb-to-curb service where you demand and it responds. Microtransit is one of the forms of paratransit or demand response service. So it gets a little crazy, but demand response and paratransit are more generic terms. Microtransit, ADA complementary paratransit, they're more specific, or taxis or Uber and Lyft. They're more specific forms of paratransit.
Thanks. Microtransit, I think, so they're asking for some examples. If you're able to describe some examples in detail in, rural or small urban areas, could you describe those examples and how they've been going so far?
Sure. There's one that I'm about to start evaluating in Bastrop, Texas, a town about 30 miles out of Austin, and it's about 10,000 people. it's become more of a bedroom community. It's got a lot of shopping, and it's got the old town as well. CART's implemented a microtransit service there using one of the apps that are out there, and there's a number of apps. And basically, they started using electric vehicles as well. I think they're using CNG at this point for various political reasons. But basically, there's 3 or 4 vehicles that are circulating the community. And if somebody wants a ride, they get on their smartphone, they go to the app, and they request a ride from whatever location. That information is then forwarded to the appropriate driver, who then acknowledges and then comes and picks you up. And it usually tells you the vehicle will be there in 10 minutes, the vehicle will be there in 15 minutes, walk to the corner, those sorts of things. There's no dispatcher intervention whatsoever. This is all between the smartphone and the vehicle's mobile computer. So the ride is typically paid for over the smartphone. And then the person gets in, the person gets picked up, gets taken to where they want to go when they're ready to depart. They use the app again. In the fastest mode, it's 15 minutes. If you have enough vehicles, they can pick you up within 15 minutes. You could go to an hour if you like as well. That would require less vehicles. But from, as I said earlier, from the internal perspective, it requires very, very little interaction with the dispatcher. Once the drivers understand that they have to follow the schedule, because that's what the computer's adding trips all the time. So they have to follow the schedule in order for it to all work right. So those are, that's basically how the microtransit works. You can also, because Title VI is important, you can also use your cell phone and use a voice and call, and it will, you'll get the dispatcher who will then load up the trip for you. Reports I've heard is that initially there's some phone calls, but after a short while, there's very few. And when I was riding up in the Native American reservation in Northwest New Mexico one day, riding with the customers, we were chatting, and I noticed that I had good cell phone coverage in this town that we were in, that we were circulating. And I said to, there were 6 people on board and the driver, I said, does anyone out here have smartphones? And they all answered in unison, we all have smartphones. So that's when it dawned on me that, yeah, we can do this. But if you don't have a smartphone, you can still call and access the service, and you could pay with cash if you want to on board the vehicle. So that's basically how the microtransit works.
Thanks. Go ahead.
Yeah, there's a variety of apps out there. Some of the more traditional paratransit companies are getting involved in it, and they're turning some of their old school day in advance type of models into same day models as well. So there's a variety of them out there. And in terms of, which ones are good, which ones aren't good, that's not for me to say. But I would suggest, getting a hold of a few of those that are operating the apps that you're considering, and go and visit, go and talk to them, talk to the drivers. Drivers and dispatchers, they'll spill their guts. You ask them, especially if they're not around the boss, they'll spill their guts. They'll tell you what they really think. And sometimes that's positive and sometimes that's negative. So do the proper investigating. And there's a number of good apps out there that from what I've heard, that you would be able to use.
Thanks. I was mentioning that we did a webinar, I think it was fall of 2019 now. I have no sense of time these days, but we did hear from one system who was piloting a microtransit, and I think they were using VIA. But we at National RTAP are, I don't think we have a timeline for, but wanting to put together a follow-up with them and hear some other agencies who are doing microtransit, and then also, I don't know if it will be separate, but kind of a showcase where you can learn about the different apps and, again, not promoting any of them, but just sharing some more information about that. So if that'd be of interest to people, let me know and we'll keep working on that. A couple follow-ups in the chat if people didn't see it. One about purchasing vehicles for microtransit. So and Ken, you can chime in on this too. When purchasing or leasing of microtransit vehicles via a federal program, keep in mind requirements for accessible fleets, like how many accessible vehicles are needed or, versus the full fleet. Federally funded microtransit requires that accessible service is available. So very important.
I would recommend that all the vehicles be accessible. That would be my recommendation. It's not necessary as long as the fleet as a whole is accessible. But my recommendation would be every vehicle.
Yeah. Another note, the ADA dial-a-ride regulations require ADA accessibility to request the ride and for the ride, but all persons are served under the same rules and service. And service for a person with a disability can't be denied unreasonably due to capacity constraints. So yes, that is.
I would agree with that.
Yes, that is true. So here is another question. Could you provide some tips on a project timeline from analyzing need, planning new routes, and testing implementation for a small urban system? So what is an appropriate time frame for redesigning or developing new systems? And then sub question to that is how best to include your drivers and dispatch in getting their input.
Say that last part again.
What, how, other than just, interviewing them, as you said, but are there other good strategies for getting your drivers and dispatch involved in planning?
I'll answer the second part first. Yes, absolutely. I typically like you want to have them inside the tent, and you don't want them coming to you afterwards and saying, oh, nobody asked me about this, because a dispatcher or a driver can make or break the technology very easily. I recommend in the initial planning to have representation from drivers and the dispatchers, and in the selection of the technology, I would recommend that as well. A system I worked with just recently did that, and one of their dispatchers was on the selection committee, and when it came time to implement, he was behind it, and so the rest of the dispatchers joined on board. So definitely have driver and dispatcher input, and have them be part of the team that makes the decision, and select the right people, vocal and reasonable. It's two good things right there. In terms of timeframes, that obviously depends on how quickly your organization is able to pivot. Some systems are really used to change, and the staff all embrace it. Others are a little slow to embrace, and that's the way we've always done it, so I'm not so sure. So it really depends on how quickly you can motivate your staff and what kind of staff you have available to do this, or to hire consultants. But I would say, a couple of months of planning, and then the main issue would be getting the vehicles. So one of the first things you would do would be to get vehicles if you don't have, because that's going to take the longest amount of time. So it could take 3 months if you have vehicles. It could take 6 months. It could take a year, and it also depends on how quickly you're able to procure or lease technology. So those are the big things: how quickly you can do your procurements. The rest of it, you can adapt fairly quickly if you got good people who are willing to make the change.
Okay, thanks. So we still have time for a few more questions, but as we don't have any quite yet, feel free to still ask one. But I did want to point out a couple upcoming national RTAP events. We do have one that might be of interest to this audience, a Transportation Management Association, or TMA webinar, about working with employers and providing transportation to improve rural job access. So that's on the 22nd of September. And then there are we are not so the Rural and Intercity Bus Transportation, or RIBTIC, is a TRB conference. It's October 25th to 27th, but National RTAP is going to be hosting some pre-conference workshops. So definitely register for the TRB RIBTIC conference, but also we'll have some free virtual trainings the week before, and stay tuned for the agenda that's getting finalized. And those will be on Zoom. And then we are hosting a hybrid conference. It's in conjunction with the Minnesota and Wisconsin transit conference. So it's focused on tribal transit, but a lot of the topics would really be relevant to non-tribal systems. So you see some of the topics listed there. The virtual sessions will be free of charge, and those Zoom links will be shared soon. And you can visit the conferences page of our website to learn more about that. But if you're interested in going in person, you do need to register, but we do have some scholarships for tribes. So those are some upcoming events from us. And I'm not seeing any more questions, so I will wrap up. And I shared Ken's information in the chat also. So if you do have other questions, let him know or let us know, and we can connect you. And I'll put together a Q&A, probably not until a week from now, with the questions asked today and the answers provided. And we'll have the slides and recording available also. Did want to mention that earlier this year, we launched, in conjunction with the other technical assistance centers funded by FTA that are listed here, the Transportation Technical Assistance Coordination Library, or TACL. And that is a library that is focused on transportation coordination resources. And we are holding a Twitter chat about that in October 20th. And so check that out, and check out TACL and the resources listed there. And let us know if you have any questions. And that's it. So you'll see a post-webinar survey when the webinar ends, and we'll also send an email out with that. We love your feedback and any suggestions for future webinars. Yeah, I think that's it. So thanks everyone. Thank you so much, Ken. And thanks everyone.
Thank you, everybody.
With our technical difficulties. And we hope you have a really great rest of your day.
Thank you.
Thanks.